how far we are going to looking at when we are studying Ayurveda, how much we are looking into the Vedas. For example, we just learn Atharva Veda. Ayurveda is a branch of Atharva Veda, like. But after that, do we look into the Vedas anything? No, because we don't have that. We have so many other socio-political this thing, which prevents us also. Our way of looking at things have become that in Greek this has been told, in Egypt this has been told, in that civilization this has been told, and we never were taught that in Indian civilization we had this. So as far as the Jijnasa class is concerned, I am telling you that we never look into the Dhanur Veda, what is there in that. So I am very glad to tell that now a MSc integrated interdisciplinary course has been started in National Institute of Ayurveda, a 2-year course, which is on Krida, Ayurveda and Marmology. Only two seats in every batch. So that may be now a beginning, and many other universities are trying to take up this one. And recently, in the last syllabus revision only, one topic came in Shalyatantra as sports medicine and its Ayurvedic relevance in sports medicine, etc. So it's of morning, as you told, I started my journey in 82 in Kottakkal, and I dedicate this presentation to Dr. G.S. Raju, who was my teacher, who initiated me the interest in Marma, who passed away just now, 1 week back or 10 days back. So with regards to all my teachers, and even the book, whatever we saw in the morning, is a inspiration which I got from those teachers who are there. So this is a long presentation. I will be skipping some of the slides because it will be in a little more detail. Only thing I want to tell that don't stop where what we have in our textbooks, what we have in our which is given as notes and all. Think beyond that. Wherever we can apply the Tridosha principle, wherever we can apply the Panchabhautik principles, wherever we can apply the Prakriti, Vikriti principles, whatever we can do, where that all are areas. And the last but one slide of Arjun sir was telling that. Now what we always talk about the threats only. We don't talk about the opportunities. So whatever be the threats, if you are able to convert them into opportunities, that is where you are successful. So if we believe that, the two persons who are there in a shoe company, know that they were asked, you go to this island and see and come. What is the possibility of selling shoes or footwear over there? Have you heard that story? No. So the first one came and told that, sir, I went and made a survey. In that island there are this many thousands of peoples, but they don't have a habit of wearing shoes at all or footwear at all. And I think that there is no scope for selling footwear over there. The second person came, and the second person was asked, what did you find, whether there is any scope? He told that, sir, wonderful opportunity, sir. None of them are wearing footwear there. We can simply go and sell it, telling that this is the way we can do. This is what situation we are in. So if anybody of you have a feeling that what Ayurveda has to do in this modern era, health, this one, then you can see that if you are able to find out where it is needed, what is needed, and if you can deliver that, then the scope is there for you. Otherwise, we will be all sitting and crying only. So, as Arjun sir told, improve your sattva, try to find out opportunities where threats are there, and be courageous enough to. How we withstood when we started in ISM, the Sports Ayurveda Research Cell, and how we withstood over there, and this state games, you can see that there were 20 specialists and 60 medical officers with an entourage of another 100 paramedical workers who were manning the whole Kerala State School Athletics and Games Festival. So that much vyapti we have got now, where 10 years back when we started, there were only 5 units with 5 people over there. So this is the scope, and you can Google and see that what is the role of SARC in sports Ayurveda, ISM in the sports event which happened over there. So I'll just give a glimpse of, because seeing is believing, and we can have propositions, many things. No, oh sir, this can be done, that can be done. There is so much of possibilities. I can also talk on length on that. But what happens in the field also you have to see. So there are few slides which will show that. So be with me and we'll proceed. So what do you see here? This is a say 2018 slide, I think. 2018 slide. When I was the head of the Palakkad Sports Ayurveda Research Cell, and the man in blue shirt, he is still in service in Kasaragod. He was my assistant as the special medical officer for Sports Ayurveda in Palakkad. You see, this is the Palakkad Medical College track where a festival, sports festival was going on. And you can see that it is an on-field injury which has happened over there, and the patient is shifted to the tent. So sports Ayurveda would have developed where? Marma, where it would have developed? It would have developed in the battlefield only. So you have some Vaidyas there sitting there, whoever gets injuries, and that's how they got Pranashta Shalya Vijnaniyam. That's how you got Marma injuries. These are the injuries: Satyo Pranahara Marmas, Kalandara Pranahara Marmas, Vaikalyakara Marmas, Rujakara Marmas, etc. You know that? So he is being taken to the tent over there. So this is a real thing. This has happened now. That's what I'm telling. In 2018, this is thing. 2024, in Ernakulam, now the Maharaja's ground, or wherever the competitions were going on, you had hundreds of these things happen. So understand the strength of Ayurvedic Shastra, Ayurvedic principles. Of course, sometimes wherever it is needed, integrated with the modern knowledge. So here we will be talking Marma massage. I am telling Nadi Marma massage. I am not going into the Nadi Marma aspect of it. But once we see that, okay, these are the areas of massage in modern sports therapy, and whether we are fulfilling that, then you will be knowing that. Okay. Next, please. Say is being treated on the ground itself. So you should have the required equipments and other things, etc. And is being treated there itself. So it's not something from the air I am telling, it is what is being done. Next, please. See, this is the small tent-like thing which we will have whenever we are going to give this service to these people. You can see that the board is there. She is Dr. Shiji, she was until now posted in Kerala Institute of Sports Ayurveda Research. KISAR, you can refer KISAR, Kerala Institute for Sports and Ayurvedic Sports Ayurveda and Research, which is a 50-bedded exclusive hospital for sports injury management, sports injury prevention, and preparation of the athletes. And this one, can you imagine? That is the first. Whenever what is happening in Ayurveda, I can tell that in the world itself. So we have in Thrissur a 50-bedded, only one in the world we can tell, purely Ayurvedic sports Ayurveda management. Okay. You can see that examination is going on. Next, please. You can see that volunteers, helper is there, a therapist is there. The patient is one patient is looked up in this one, another one is being taken care of in the other one. Next one. See that immediately on that ground itself, if injury is there, Marma management is being done, Bandhana is being done, and the patient is, sometimes we get challenges there. In normal practice, we can see that, okay, you can wait for some time. As Sir told that every Marma management is not so fast. Some which requires rest has to be given rest only. So this is, sometimes they will have at the end of the day, they get an injury, but tomorrow they have to perform. So all this Sattva Vajaya, along with all these things, injury management, with wonderful Murivanna which we have as a boon and blessing, we will be doing that. So you can see that an ankle bandage. Can anybody finally, as house servants, tell that what is the type of bandage? Bandhana, what bandhana? Okay, that's a different class, like Swastika Bandha, which is being done at to protect the Gulfa Marma, because ankle injury is the most commonest injury in sports medicine. So that one. Next one. Okay, you can see me also just coordinating things over there because the others are there. You can see that again leg injury which is being examined. You can see that I am showing this photo because you can see that what are all the gadgets which you require in sports medicine over there. You will have to have cotton gauze, oil or ice pack if it is required. Sushi the labor immediately after the show. So these things will be there. Next please. Okay, so that gives you an impression of what is being done in sports Ayurveda as a sports therapist. Now these are the common sports injuries, like every part of the body which can get involved in any other sport. So specific sports have specific chance of injury. Football injuries are there. You know something like tennis elbow? Yeah, it got its name from doing a hard backhand drive repeated stress injury. Golfer's elbow. Do you know that runner's knee? Muscle cramping, shin splint, knee injuries of various types, side stitch, plantar fasciitis, blisters and sores. So these are low back strain. So these are rotator cuff injuries. These are many of the things which can happen. Are they new things? We call it otherwise in our own language. This is not. Many of these Nanatmaja Vada Vyadis, you have all those things over there. Either it is a Graha or it is a Shula or a Ruja, etc., etc., etc. Which is, and Vada Vyadi Nidana, if your teacher has taught it properly, then you know that Marmadhigada is one of the reasons for that. Okay, so that's how we correlate with our Shastra with whatever is available there. It's not for just telling that, okay, we will study Pandu today. Pandu is anemia. Anemia is this. Not like that. But go to the depth, go to the basic level, go to the pathological level, go to the therapeutic level, and then you compare. Okay. Next. Most common causes of injuries are failure to warm up. So we are entering into the subject of sports injuries, prevention of sports injuries, so that we can talk about how Marma massages can be used in all these conditions. Okay. So failure to warm up, overtraining. Just now I have been talking to, your principal was talking to me. How many have put your hand here and tell that I do some physical activity daily, except physical activity for the 2 fingers of the hand? Tell me. Do you do some exercises daily? Yoga? Okay. As sir told, he told that very good. I thought even I should follow that. 15 minutes of 24 hours for breathing to realize that ourselves, what are the potentials of breathing. Many times we tell that you learn the cost of that breath you take only when you pay it in the ICU for oxygen. Until that time we have taken granted that we don't realize that. So protecting that is very much needed. Excessive loading on the body, that is sahasam. In Ayurveda we call it sahasam. Not taking safety precautions, an accident, inappropriate equipment, poor exercise technique, recurring or reoccurring injuries, genetic factors of which Dr. Pradeep will be talking now, of Prakriti and other assessments. Lack of flexibility or joint laxity. In this group itself, I will tell that at least 5 will be there with hyper-extensibility of the joints or flexibility of the joints. Are you there? Anybody who has a tendency always to fall down whenever you are walking? Girls? There will be at least somebody. Know that? They will have usually a very wet hand. Always during exam they have to have a kerchief and then wipe it, and this one, that is a Prakriti. And these patients, I am telling about this because such boys and girls come to us every time I fall, their parents will come anxiously. They would have taken to 4 different ortho, one Ganga, Rex, other hospitals and all, and they come and then come to us that I just ask them to do like this. Oh, it goes more than what is required. Done. Yours is this type of this one. Now what we can do, only Snayu Sthairagara or Asti Sthairagara medicines you can give. And if they take it, we wonderfully see that if their pitta comes down, their laxity comes down, and they are much more safer than them. Prakriti you cannot change, you are talking. But still that is what. So over laxity. So with whatever it is, this thing, I tell that you can go to we can go to our Ayurveda and analyze and do it. Now, not taking safety precautions, excessive, taking safety precautions. What has been told, whatever we are doing, morning I told about Swasthya Samrakshanam, Adurasya Vyadhi Prashamanam, I told. What is actually being done? What is actually being done? As a Marma person, I will tell that we are only concerned about Marma Paripalanam. Whatever we are doing Paripalana of the Marma. What is Marma Paripalanam as has been told in Siddhisana? Charaka? Intramarmi, yes. Abhada Varjanam Nityam Swastavrattasya Anuvartanam Uttarnarthi Vigadanam Marmanam Paripalanam. So what is told? Abhada Varjanam Nityam. Avoid any type of accident to be happening. Take precautions. So that is what has been told. If the marmas you protect, you work the other marmas also. But in sports and other things, the local marmas are more, there is more chance of Vaikalyakara marmas and Rujakara marmas to be involved. You take the protection over there. If you don't take, you get chance of injury. So warm up is it needed? Can you just get up one day morning and go for a half marathon? Can you do it? 21 kilometers can you run? So you will prepare. For 1 month if you prepare, then you may not be able to. So warm up and these things have this much. Next please. So sports massage. So massaging, sports massage is a very big area. Every team will have, or every athlete will have some, very, very big athletes, well-known athletes will have their own physiotherapist, their own massage therapist for them, for their events. So sports massage is a big area which is being recognized by the Olympics also. And what we do as Abhyanga, how we convert it to the Marma Abhyanga and then sports massage, that's one thing which we will discuss like. Okay, now I just a picture representation, of course. I'm glad that it's my own hand again, because I always believe that preach what you practice and practice what you preach. Okay, so believe first of all that all these things are possible things and not otherwise. Next. Sports massage is a combination of special forms of massage developed to help the athletes, physically active people, as well as those with high level of stress to reach their peak performance. That is one of the definitions which you can have. Why it is needed? So other things will be coming like prevention of injuries, etc. This is one definition where the massage is effective during an event. An event is happening. So massage, pre-event massage is different from event, in between competition massage and post-event massage and preparatory massage. With all these things we will be just glancing through. So this is one of the, so you can see that special forms of massage developed to help athletes and physically active people to reach their peak performance. Next please. Can anyone tell me what is the effect of Abhyanga? As per Vagbada or anybody? Abhyangam Ajare Nityam, it has been told, even though it's not Nityam. So Jara, Shrama, Vada. You are a sports person is always doing, that Sahasa. He is extending his body's this one to that. So Jara is something which can happen faster. Shrama, he is tiring out. Shramhara. So very, very equivalent to this thing you can give. He has a tendency to increase his vata in the body, so he will suffer vata vyadi, anatmaja vyadi, which I told, by overuse, by repeated use, etc. So that also. Pushti, Ayuhu, not even very sharp they have to be, is it not? Drishti Prasadam. Remember, Arjuna was asked to do only one thing. Look down at the shadow and hit the eye of the fish on the top of the pole. So, Abhyanga, how it sharpens a runner, we tell that if his muscles are okay and if his eyes are not okay, is it worthwhile? No, he has to have the proprioception properly fed through the whatever, wherever he is having the feeling, wherever he is having the sensory, this one, etc., etc. So, thereby we can directly tell that how Abhyanga contributes for helping a athlete or a sports person. Okay. Sports massage is incorporated as part of medical service at Olympic Games and professional competitions also. Only after independence, 70, 72 years of independence, we are still 74 years of independence, 75, of course. We are struggling to find ourselves. We are imitating everything from the Western world, but we are not proud enough to tell that this one. And what SARC also, what we face from the government many times is that where is the proof? You don't have the proof of, you don't accept the 2,000, 2,500, 3,000, 5,000 years proof, but you want paper proof over there. So we have started making proof now. How many people are coming, how many are getting benefited, their credential, their response. How they went to the modern, this one, what they achieved, how they met Ayurvedic sports doctors and how they were benefited. So this is one thing which I tell you that this documentation is very important, and then we may sometimes, after all, getting into the national games and then into Olympics or whatever it is. Most effective techniques used for sports massage are based on the gradual influence on tissue and reflex reaction. So these two things you have to remember. Massage is effective by its influence on the tissue, whether to sedate the tissue or stimulate the tissue, whether to relax the tissue or tighten the tissue. This is what is being done, and the reflex reaction for that. What is massage actually? Or what is Abhyanga? What we are doing? By giving medicines, you are biochemically altering the system, no? With massage, how it is happening? Tell me, I don't want any technical, highly technical thing. Whatever Ayurveda you know, you tell me. Vata anulomana or correction of vata or regulation of the vata is being done. How? How? Yeah. We are using our sparshanendriya over the sparshanendriya of the patient or the receiver. The giver and the receiver are there in massage. And that sparshanendriya is directly related to vata. Vata, it is Vishya Vata. And thereby, vata is related to the manas. And when you have, okay, you are in agony and somebody is in agony, you put your hand over there, and you know that immediately your vata is getting corrected, your manas is getting corrected. Okay, so that is sedation. But whenever you are, dull, then what you do usually? When somebody is dull, what you do? Oh, good. Why? You pat it, is it not? You stimulate it. Otherwise, if the baby is crying, there are two types of mothers, no? How many mothers are there? All teachers are there. Sometimes the baby cries. And then, usually when the baby cries, what you do? You try to take it, put it on the back and slowly do a stroking massage, caressing massage. Instead of that, There are some others who are, why are you crying? Again, the child will, what will the child do? So whenever somebody is in pain, how you should be dealing with, you have to know. So that's Sparsha, if you are able to give. So that's what is to be done. That should come from here. That what type of touch is required. And that touch, if it is given in the form of massage, then you know that, I do in Marma massage, you know that you bring back the normalcy of the Vata, and thereby Vada Adhrade Nasti Rujaha. So when the Vata Shamana occurs, Ruja Shamana occurs, you know that you are giving this one. Okay, next please. Forms of sports massage. Now there are different types of sports massage which we are incorporating into Ayurvedic Marma massage also. Training massage serves to prepare the peak for performance. Prepare the body for peak performance. That is training massage in between. Preparation massage done just before performance. Already the event is going to start at that time, whichever you relax this ones and all, that is preparatory massage. Break massage during performance to hasten regeneration of energy and tissue and support mental stability. That is, say you have 3 attempts. After 1 attempt, in between this is done, so that you can do a better this one. So at that time, there is an interaction also. Sir, I am feeling that I will not be able to do. No, you will be able to do. I am massaging you. Next time you attempt. So Sattva, which Sir told, will be coming as a part of it. Okay. Break massage. Okay, that is called break massage. Next. Forms of sports massage. Anti-fatigue massage. That is applied after the performance. When the patient is getting fatigued, to relieve the fatigue. Sramahara. What you will translate it as? Sramahara massage. Relaxation massage. Specific application of the standard effleurage, petrissage, vibration and friction techniques. How many of you are hearing it for the first time? The techniques of massage? Effleurage, petrissage, shaking manipulations, etc. You can just will be, if I go into that will be another class actually. This is techniques of Abhyanga. We'll come to that sometime if possible. So they are the stroking manipulations are called effleurage. The kneading manipulations are called petrissage. Tappotment is the beating or the percussion manipulations, and the other one is the shaking manipulations. So this is what we are doing in Abhyanga therapy actually. But generally what has happened in Abhyanga in Ayurveda colleges and usually in Ayurveda is just a linear stroke. Who can tell Vadasya? We are reading Vadasya, we discussed yesterday only. Is it not? Vadasya Upakrama? Swadamla Lavanošnani Bhojani. Abhyanga. Next is Mardhanam. Mardhanam has been told. Unmardhanam has been told in Kava Chikitsa. Mardhanam has been told in Vada Chikitsa. Vada Uttara Chikitsa. Unmardhanam has been told. So Mardhanam is also part of it. But we never use that Mardhanam in this one. We tell that is a Marma person's job or that is a Kalari person's job. It is not Ayurveda like that. You are having the quotation there itself. Mardhanam. Trasanam, Veshtanam, Sego, Madhyam Bhoja. Trasanam you undo. Shaking. Veshtanam, Bandhanam. So these are all part of Marma Chikitsa which we have to learn it and apply it to the sports persons. Like include massage with guided relaxation. Guided relaxation. Did we have a guided relaxation over now? By Arjun sir? Yeah. Because if you are not able to relax, but somebody put their hand on your body, make you lie down, with that relax. If it is just guided, the body will be able to do that. So that's what we do when this one is in agony. The body is in agony, in pain. Okay, next. There are neuromuscular techniques which are now very, very popular. They are charging too much for each session. They are charging so much money also. But if you have the buddhi, you know that these are methods told in the Shashti Rupakrama of Ayurveda, of Sushruta in Pranachikitsa. One is the trigger point, tender point release, tension point, neuromuscular re-education. Then there are the fluid technique massages, movement and exchange of fluid facilitation. When you have lymphedema, when there is a athlete who is having a tendency to pull in edema of the foot, then you do a fluid, relocating this one. So you start this Swedish massage like Pratiloma massage from foot to heart. So all these methods are available with us. And he told about Vata Anulomanam. What is Anulomanam? Usually what has happened is that, no, in India, where is Kashmir? Because we know that the earth is round, but we have always seen the atlas only. Sir, Kashmir is on the top, sir. Where is Kanyakumari? The bottom, sir. This is the way we have learned. My dear children, if I ask you the way we are learning, it has to be changed. If I teach you as a teacher, sun rises in the east, that's what you learn. Sun rises in the east. But if I teach you the direction in which the sun rises is the east. Got it? Perspective, he told, 6 and 9. So this is what we have to learn. We are not learning a very linear science. We are learning a multidisciplinary science. If we don't have an outlook like that, then you are led somewhere. So like that, this Anuloma also has become like that. Sir, Anuloma. Anuloma means? This is what we have done. Haven't we studied the sthana of each vata? How many vatas are mentioned? Okay, for us 5, 10 for somebody. In Marma Shastra also we come to. But 5 are very clearly, Doshbhediyam you have learned. Dhama you know, which is the location you know. Is it not? Location of all the vadas, everybody knows? Everybody knows? Anybody has a doubt? Dhama means location. The back crowd is very, very silent and serious. I should go over there, I think. Do you remember the places which is the place for Udana Vata, which is the place for Samana Vata, etc.? Sir, simple thing. Why do you are making fun of us like, no? Remember, just there's a chance for you to remember. Now I tell you, how many of you remember the charana of each vata? Charana means the direction of flow. How many of you remember the charana of each vata? And you remember, anybody who is remembering, you are onto the track. Otherwise, others start remembering what you studied. Then you know what is Anuloma and what is Pratiloma. If your hand movement during Abhyanga is along the passage of the charana of the vata particular at that site, that is Anuloma. Not just like this. Anuloma means the hairline is the one which shows outside. But when you know the Nadi, Gati and all, then you should be knowing much more. Simple thing is that, can anybody tell about the charana of Udana Vata?
Urasthanam udanasya nasanavigalamschrit vak pravrutti prayotnorja balavarna smritikriya.
That is the function. Charana is Nasa, Nabi, Gala. So now you tell me which is Anuloma, which is Pratiloma. Prano atra murdagaha. So if you are doing just like this, murdagaha. Yano Krishna Dehajari, going to the end and coming back. So when you are applying the massage on the limb, going down and coming back, when you have in your mind that, okay, you have to improve the utsaha, bala, varna, smriti, kriya, is it not? But prayatna, urja, patient massage you have to do for a sports person is urjam has to be increased. So udana has to be stimulated. Marma massage you are doing. You should be knowing that it is nasa, nabi, up to nabi it is going, then it is coming to the gala. So when you are massaging, you know the direction done. So it is very easy actually for us, which we all make very difficult, because we will take a textbook and then that in that arrow has been put like this, then it has been put like that, then we will try to, after all what we have to do, go back to your dosha vediyam, go back to your sutrasthana, learn what is the charana of this one, then you know that. Apano, apanagaha. When apana is not apanaga and it is urdhva, you know that you are ending up with. You got it now? These are all the small Piravugol Vital in Marma. Until now, if you have not been thinking, from today, 17th November 2024, 2:45 p.m. or 3 p.m., you start. That's what we are very sure about it. And you can either forget it or you will lose it when you die. That's all. So you never forget it. Once you learn it like that, you will never forget it. You learn for your first year exam, you learn for your second year exam, gone. Because Marma, we are not applying for Nidana, Marma, we are not applying for Chikitsa also. So once we are using I will introduce one more term which has been, what you call, coined and being propagated by me itself. Start using are you using your stethoscope? Do you know the use of telescope? You know the use of microscope? Okay? No response at all. No response at all. Then start from today onwards. You have studied Marma Vibhaga. Start using the Marma scope. You try to find out. You are finding okay, head is there, brain is there, the nasal sinus is there, the buccal cavity is there. Like that, you start now seeing Adipati. You start seeing Stapani. You start seeing the Avartas, you start seeing the Shanka, you start seeing the Panas, you start seeing the Manyas, you start seeing the Neela, you start seeing the Matrakas, you start seeing the 11 Marmas in the hand whenever you are examining the patient. Whenever somebody is coming with, just because if I don't tell Marma how it can be applied in a sports person, it is not. A patient is coming with Bahu Swapa and Bahu Sada. He is coming and telling that I am having numbness in my forearm, upper arm, and you find that it is Shosha also. Hey, I am getting it weakened. Which will be the Marma which is involved? Have we studied it? Anka Vibhagam, Marma Vibhagam, we have studied it. But because we are not using the Marma scope, we never thought about it at all. We see that, sir, it will be the C3, C4 level, that cord level injury, sir. It is the axillary nerve which is getting injured, sir. All these things we will tell. But we will never tell that, sir, Amsafalaga, he would have suffered an injury at the Amsafalaga. That is why after 2 or 3 months he is having tardy palsy. Our science is very, very rich. Our Shastra is very, very rich. But if we don't look into it, we will be poor only. So my advice is that start looking into it, go deeper into it, and then you will understand. Okay, next please. So Anuloma clarified? Okay. Friction massage. That friction always, two people are having a fight. What will be there? Fire. Heat will be there. No? So friction massage always creates heat. Whenever Shita is there, you have to, what you call, do Garshana. Garshana Prayoga has to be done. So friction techniques applied in general manner to create a stretching and broadening effect in large group of muscles. For example, there is a Sankocha. Sankocha, is it a Vada Lakshana? The Sankocha has to be released. Or there is a contracture. The contracture has to be released. It is the opposite of Sramsa, is it not? When something falls off, it is called Sramsa. Can you tell what are the Vikrita karmas of Vata? Because any session has to be, you know, that it should be a revision also. We are all teachers also. So, Sramsa Vyasa Veda Swabha. Sramsa Vyasa Veda Swabha. Sada, Rup, Toda, Vedanam, Sanga, Angabanga, Sankocha, Sankocha. Varta, rotatory deformity. Harshana, Tarshanam, horripilation, paresthesia, Tarshanam. Kampa, Parushya, Saushirya, Shosha, Spandana, fasciculation. These many prakatanas can be there. Pain can be just pain. Pain can be associated with contracture. Pain can be associated with what you call Slatangada. For all, treatments will be different. Vada's treatment will be different in different situations. So friction massage, compression massage is rhythmic compression into muscles used to create a deep hyperemia and softening effect in the tissues. Also has a stimulating effect, that is compress. When you compress an area, you are actually creating a hyperemia over there, and then thereby the stimulation occurs. Okay. Next. Now we have another classification, that is this thing, pre-event or preparation massage, inter-competition massage, post-event massage, rehabilitative massage, massage it is called, preventive massage. So these are the areas which will be useful for you. I will ask the organizers to share this slide also, so no need to, you can write it down if you want, but it's all available over there. Whatever is there, there is nothing new. Whatever my teachers have told, I have referred from the books. It's so much there in the internet also. I have just tried to put it in the perspective of Ayurvedic massage. Next, please. Now, most common other massage techniques are classic relaxation massage. You want to relax the athlete is after 100 meters running a series of competitions, or cricket. You know that there are 5 20-20 matches, then 5 tests, everything, and then the athlete wants the relaxation. So classic relaxation massage, simple abhyanga, where there is nothing to be done, simple abhyanga has to be done. Deep tissue and myofascial techniques, Mardana massage. Neuromuscular release, Vimlapana type of massage, where only, what is Vimlapana? What is Vimlapana? One among the Shashti Rupakramas, Prana Chikitsa, Prana Shoka Chikitsa, clue. Angushtena talena venunava mardhanam, Vimlapanam. Either you are using your thumb, or you are using your tala, or you are using a venu or rod like instrument to remove the swelling. Fluid technique massage, I told about the reverse massage, where you, wherever fluid is pooled, that is being taken off. Next, please. So classification by technique, by timing as a therapy. This is a comprehensive chart. You can see that. By level of the athlete, he can be amateur athlete, Olympic or a professional. By technique, again you can see that the sattva or the need or the demand will be, a Olympian's demand is very different from an amateur player. Is it not? So that way classification by technique, relaxation, deep tissue, neuromuscular techniques and fluid techniques. By timing, pre-event, post-event, inter-event, preparation. As a therapy, injury prevention, injury treatment and pain management. So in pain management and all, Tamil Varma Chikitsa has a wonderful, you know that Tamil Varma Chikitsa or acupressure techniques, like many other techniques are also there. You can give very good relief for the patient immediately, which are being incorporated into it. Next. A massage therapist recommended training sports massage. What you have to, if you, any one of you want to tell that, okay, I am becoming a massage therapist and that too a sports massage therapist, then you should have, first one, read. Because it is your, this one. If you want to become a good surgeon, you should be having. If you want to good physiotherapist, you should have it. Deep knowledge of the anatomy, physiology and kinesiology. How many of you heard the word kinesiology? If not today itself, go and you can get JP books in the library also, it will be there. Kinesiology is the study of the body's movements. Okay. Functional anatomy, we are not learning much. Clinical anatomy, we are learning in relation to the surgical situations, etc. But functional anatomy, we have to learn how, when you are taking the one step, what are all the muscles which are contracting, which are relaxing, which are the muscles directly involved, which are the muscles which are accessory in nature, and such things if you don't know, then you will not be able to plan a treatment or even give an effective massage. Okay. Knowledge of the variety of massage techniques, including basic energy work and stretching concepts and principles. All these things. Separate books are available for stretching methods. Separate books are available for massage techniques. So it's a very, very wide area, which I can just give a reference over here. Next, please. Common sports-related injuries, techniques to eliminate pain, spasm, cramps, prevent spreading edema and bruises, treatment protocols for acute and repetitive strain injuries. This you should be knowing about common, I told, no? Which are the common. You want to become a sports massage therapist, then you should be knowing which are all the common injuries which are happening. You should know the techniques to eliminate pain. That is, you have seen that, no? Whenever a runner is the starting position is there. No, if that starting position is not correct, and spreading edema, that's what a fluid exchange. This one we have to do. Bruises, treatment protocols for acute and repetitive strain injury. Whenever you have an acute injury, the situation is different. Whenever it is a repeated stress injury, the situation is different. So both what you call chronic injury management and acute injury management you will have to learn properly. Then the PISR protocol, police protocol, etc. are there, which you can refer to. Next. Be able to recognize exhaustion, overheating or overcooling, dehydration, and the right time to refer the athlete to the medical professionals. So we can do to some extent only there. No? So once first aid has to be given and the patient, the condition is beyond our control, then we will have to refer it to a higher center. So basic life support system, Adangal and Marudattu, that all we should be learning. And that will be the biggest contribution of the Indian Marma Shastra towards resuscitation. Nowadays we are learning resuscitation as cardiopulmonary resuscitation and BLS only. Do we talk about the Indian contribution over there? No. But some of the Adangal techniques are so good. If you support that with an adhesive plaster, that job is done. At least next day he can run and do the job. Later you can treat it. K-taping is also like that. Nowadays in many sports you have seen blue tapes, red tapes, etc. So taping. Knowledge of sports, ointments, oils. Now sports Ayurveda researcher has developed in Kerala 4 or 5 oils, sprays, what you call special ointments, Shadahara, from our own principles of Nagaradilepa, Muruvanna, etc. for that. Okay, next. The clothing, every time it is suggested that massage therapists should wear comfortable clothes that allow unrestricted movement and or according to the dress code of the event. Usually if you wear very tight dress and if you want to massage, can you do it? No. So you should be having a sports wear only. It is recommended according to the climate, Desha, Kala and all, you can have your dress, your other equipments, etc. Next. Usually you can see that in that there should be a massage table, massage chair, yoga mat if it is there, plastic fitted cover for massage table, sheets, paper rolls, headrest cover, towels. So if you want to make a list, your Shalya department in this college is going to have a sports unit. So what are all the equipments you should be having when you are going to a Nanda school is having a sports program. There you go and sit with this first aid and these things, so that immediately once an injury is happening or anything is happening, you attend. That's how it starts. Even in Nanda college, it has to start means you can start with the schools over here. Here in the college, there is an event. Shalya department should be becoming ready for that. Panchakarma department, helped by Panchakarma department. Can be done. Okay, protective gloves, band-aid, tape, bandages. These are simple things. Next, please. Blanket, travel equipment, plastic pads, water cups, glasses, okay. Maps and GPS nowadays. You want to call an ambulance, location you have to send, is it not? Okay, next. Athletic training process, you should be, now sitting at your Shalya department or sitting in the Ayurveda college only, will you be learning sports requirements of the sports person? You have to go. You have to go and discuss with the trainer. You have to go and discuss with the coach. You have to go and discuss with the physiotherapist who is attending there. All these things once you are doing, then you can know that you can contribute in, because it's a team process. It's not a single man process. Sports medicine is a teamwork. Plan of the training process is planning during 4 or 5 year cycle. As far as chosen person is concerned, you see that he is going to be a badminton champion means he is groomed for 5 years, 6 years. So he has a plan for that. It splits into yearly, monthly, weekly, daily cycles and single lesson. Each lesson has specific goals for warm-up, main part of the lesson and cool-down process. So we have to understand, if we don't talk this language with the coaches or trainers, how good you are, you will not be accepted. So we have to familiarize ourselves with the sports language and their system of work, and then we will be able to. So that's why I am giving you these words so that it lies in your head whenever you are discussing. Okay, next. 4 basic periods of training, which is called transitional, preparation, competition and vacation. Same thing only. Transitional is increasing load in order to reach next level of performance. Preparation is stabilization of the skills. That skill is kushalata. Yogaha karmasu kaushalam. Abhyasat prapyade siddhi. Preparation, stabilization of the skill, competition, peak performance, and vacation, massage or any treatment, short change of activity and healing injuries. They would have suffered a lot of injuries, and during the vacation itself, like in Kalari Chikitsa, we have 3 types of Tirumal, which is called Sugha Tirumal, Reksha Tirumal, and Kacha Tirumal. See, this is not the words newly coined. These are the words which are existing since Kalari Chikitsa was there. So Sugha Tirumal is to keep up the health, hygiene, to keep up the swasthada of the swastha athlete. Sukha. Sukha Sapnyakam Arogyam Vigaram Dukkamevacha. Whenever somebody is so Sukha, Are you in Sukhavastha? Swasthavastha? Then it is so that, how do you recognize that? Simple question. If you want to answer, മലയാളത്തിലാണ് ചോദിക്കുന്നത് അല്ലെ, സുഖമാണോ? സുഖമാണ് സാർ പറയുമ്പോൾ what do you evaluate actually? When you want to tell that ഞാൻ സുഖമാണ്, എനിക്ക് സുഖമാണെന്ന് പറയുമ്പോൾ, when you are telling that, what you are intending actually? It's like sir asked, no, how much times you have observed your own breathing? Is it not? Eh? When do we tell that? When do you realize that you have a head? Of course, when there is head weight. No? 5 kilos plus some head weight means no. Otherwise, do we realize that whether we have head? How much effort is taken by the cervical muscles to keep the head like that? Do we realize? We don't. Until we have a stomach pain, do we realize that there is a stomach? So that is the avastha. Swasthavastha is you are not realizing that you are having a body. You are at peace with yourself. That is swasthavastha. But once your leg is paining, then only you tell that my leg. Is it not? Until that time you are standing, you are walking, you are doing dancing, you are running, you will not. So that is why swasthavastha. In swasthavastha, to protect that swasthavastha, whatever is there, then is Sugatirumal. Next is Rakshatirumal. Rakshatirumal is whenever you are involved in a difficulty, you have to escape out of it. Is it not? We many a time we don't recognize we recognize the skin, we recognize the bones, we recognize the muscles in between. We recognize the blood vessels, we recognize the nerves. Do we recognize the interstitial tissues? Do we recognize that there are coverings for this, and that is what is available now? Refer Anatomy Trains. You can download the book also. Anatomy Trains is a different vision. There you have the skeletal anatomy in your lab, no? Atlas, you have the venous, you have the nervous system, you have this one. But fascia, or the kalas, fascias, do you have any chart over there? No. This man, anatomists, have tried to dissect only all the organs, and the fascia is remaining. So such a thing he has prepared, and from that what he has concluded is that, which is very, very suggestive of what our Shastras are telling, that the only thing which is continuous from the scalp to the fascia, in the plantar fascia, is this continuum of the facial lining. Because in between muscles change, in between other things come, but there is a continuity. And that is how in Ayurveda we tell that if a lady comes with, 45-year-old lady comes with foot pain, then first thing in Kerala what we ask is that whether you are applying any YouTube oil on your head. YouTube oil means, you know that plenty of them are there. உங்களுக்கு இப்படி கார் கூந்தல் வரணுமா, கத்தவாழை 1/2 கிலோ, நெல்லிக்காய் 1/4 கிலோ, அந்த இது இத்தனை, மெந்தியம் இத்தனை, காய்ச்சிங்க தேயுங்க. What happens? Paka is not good. Neerarakam, we tell that. Once the edema starts in the facial tissue, from this one, you ask that fibromyalgia, like they will tell that. இங்க வலி இருக்கா, இங்க வலி இருக்கு, இங்க வலி இருக்கா, இங்க வலி இருக்கு, இங்க வலி இருக்கா, இங்க வலி இருக்கா, இங்க வலி இருக்கா. Which nerve you will connect? Only the fascia can only. So importance of fascia to establish that only. You can refer Anatomy Trains and get more details on it. Okay, next. So we'll go there. Fascia, microwave, proprioceptors. I was telling that proprioceptors are very, very important as far as massage is one. What has been told in Abhyanga? Shiras Sravana Padeshu tam Visheshana Yogi. Is it not? Shiras Sravana Padeshu. Why Pada Abhyanga? Why Pada Abhyanga has been told? Shiras, of course, you know, the Uttamanga, the sthana of all Indriyas, etc., etc. Shrotra, okay, Vadasthana, Sushma Vadasthana, Akashasthana, Vadasthana, Akashasthana, etc. Why Pada? My dear students who are in the internship, you come across diabetic patients, no? Who had peripheral neuropathy. What are their complaints? When the foot is numb. Do they tell that just the foot is numb? Are they able to walk properly? Are they able to walk properly? Why? They are not able to walk properly. So they start walking like this. Why? Because every time you get a proprioceptive sensation which tells that you are standing here, you are balancing your center of gravity with that. That is lost. So protection of the proprioception had been given so much of importance earlier itself. So proprioceptors, next please. Muscle spindles, joint kinesthetic receptors, these are a higher level of this one. Just mentioning. Okay, next. And the most common sports massage techniques, we will come to that. Effleurage, I told that. Variations are stroking massage. Variations of speed will have either stimulating or sedative effect on the athlete. I give an example also. Stroking, a stroking movement is performed with the entire palmar surface or the finger also. One or both hands moving in any direction on the surface of the body. That is stroking. This is the only method which we are using in Abhyanga. Compression moves down the tissues with varying depths of pressure. It is anukkal or aluttal in Tamil. Murai. Okay. Pumping compression, ischemic compression, etc. Next, please. Now there are some techniques which are there, which also I will just skip through. James Syriac's technique. You can get this book, and there are a lot of information on that. In James Syriac's techniques, it is the Vimlapana which is being done. Friction, circular or cross fiber friction with the thumb or fingers. So now it is known world over as James Syriac's technique. Don't we feel shy that it should be called, or it is not called, Sushruda's technique? Who has mentioned it? At that time it's a Vimlapana. Nobody is there to ask for that. Of course, he is accepted as the father of surgery, but even the tissue release technique, Vimlapanam, is his technique only. But we now learn it as James Syriac's technique. That's what I tell that. There is no Raman's method, Gopalan method, Krishnan method, etc. because we never documented it. Or we don't feel like it is for, we know that, okay, Vaidya's job is to give the relief only, not for recognition of his this one, etc. But Kojit Dharmaha, Kojit Maitri, Kojit Esho, it happens. Friction with the heel of the hand, friction with the soft fist, friction in combination with other kinds of strokes, friction with reinforcement, friction substrokes. Then petrissage or kneading, compression kneading, vibration, shaking, rocking, tapotment. These are all comes under petrissage. How many of you know to make chapati? All of you? Put up your hand. Some exercise will be there, no? Like chapati. Your mother is giving you, or you are helping your mother. Atta is taken, wheat flour is taken, water is poured. And then what all you do? Show. Each one show some action. What you do? First of all, you mix the atta with the water. And then it becomes a ball like. And then next is, if you have anger on some of the friends, or husband is having anger on the wife is having this one on the, then that day chapati will be more soft. Because you do that. And then you take the whole thing and then, The other person in the drawing room who is sitting, seeing the TV should know that I am working in the kitchen, making chapati, tapa. And after that, what is that? Rolling into a roll, then making into small balls, then again punching, then again putting this one and that. All these methods are petrissage or kneading method. So there are different types of kneading, which is called rolling kneading, squeezing kneading, twisting kneading, flat kneading, compression kneading, stationary kneading, whatever it is you can call it. Okay. Next, please. Swedish massage techniques. Some of the pictures you can see that how you approach the body, holding like that, full palm, then rolling massage. Rolling kneading is that one. In the back and all, if you roll it. Clapping. Of course, put up your pen and this one, clap. Beat. That is clapping. What is the difference between beating and clapping? What is the difference between beating and clapping? Beat him. Neighbor you can beat. No? Beat when you do, you don't have that resonant sound. Know that? This is beating. Clapping, you have to clap and then do it. Do it. Do it on the others. Then you'll know that. At least one thing. Beating is flat hand. The other one is you cup your hand and then do that. For example, if you don't cup your hand, whether clap will be heard? No. What do you do? This is the way we make, because after 45 minutes, you know that you are going to start slowly after the food. So, beating and clapping and all, now you learn properly. These are all done on the patients, on the back, on flat surfaces, etc. to stimulate. Petrissage is always for stimulation. Okay, that is compression, pressing. This is reinforced compression. Peedanam, avapeedanam, pratipeedanam, paripeedanam. So, next. NMTs again pertains to nerves and muscles and their relationship between them. Whether there is any relation between the nerves and the muscles? Muscles, what do you call, work according to the signals from the nerve zone, is it not? Okay. So, NMT is methodology for assessing, treating and preventing soft tissue injuries and chronic pain. NMT is now taught in osteopathic and sports massage setting. So, along with that, you learn, how many of you heard about osteopathy? Osteopathy? So, refer that, osteopathy. How many of you heard about chiropractics? Chiropractics? Good. How many of you heard about reflexology? On the foot. Foot reflexology usually. How many of you heard about shiatsu? Japanese technique. Shiatsu. So there are Chinese techniques are there. So many other. How many of you heard about Sujok acupuncture? Sujok. Yeah. Sujok acupuncture. So they will be able to relate it to this subject much more than anybody. So every Ayurvedic student, I request that go through all these things. At least have a preliminary knowledge on all these things, which are all based on the principle of prana. It's all based on the principle of prana. Okay, next. Stretching. The stretching is a very good technique. Now, do you want to try that? Stretching, whether relaxes you. Do you stretch in the morning when you get up? What is that told in Tamil? Malayalam? Neliga. After sitting for this much time over here, what you will do usually after getting up? Here. Actually, whenever That's why Marma Paripalanam, the body is able to do the Marma Paripalanam itself. Because after 3 hours of sitting and writing an exam, what all things you will do? You are writing the exam for 3 hours. You know that what happens, no? Like 5 minutes, then you have to tie the paper. That time this teacher will come and tell that paper, the final bell will be done and paper will be taken off. But what happens usually, you know that at 2 hours 45 minutes only, you have finished answering almost everything. But that 7th question part A and the 5th question part B, is gap is put. Or we will write the last only. So then what you do? Then all your, because you have to pass in the exam, you have to save your prana. So body what it does? It has like, so slowly you will start. Nothing to be seen because 5 meters across you are sitting, nothing to be seen. If it is nearby, you can ask and then write. It's not possible. Then you try yourself, no? Suddenly, in 5 minutes, you tap on the Sabani, Ajna Chakra, then immediately, oh, August 17th, I studied that answer. It comes. And then all with full force, it will be coming from here to the tip of the nib of the pen. No? At that time only, this useless teacher will come and bring. So Marma works there, you tap it, and then this one. At last, teacher has taken it and gone. I could have written for 2 more marks, but it is not possible. Then finally, what you will do? Come on, show. You turn this side and show. Oh, you can. You do. What you will do generally? What all you will do? Everyone is trying to do what they are doing now. Generally, what you do? What I will do, I will tell that I will put the pen down. First thing I will do is that only, no? What you are actually doing? Your body is able to correct the disturbances in the vata, in that location, in that region, by its intense, what you call, it's every marma is supposed to have is the area where there is a tridosha, the sattva, rajas, tamas, the manas, and the bhutatma. Every cell has. And what is the icha of every prani? Are you a prani? We are all pranis. Because we are harboring prana. Prana eshana. Have you heard? Every thing which is having a prana is having a mechanism to protect its prana. So whenever something is, you have put it into full stress, all 3 hours, and then you are not able to, then you know that the vata has stuck all over there. You want to release it. You want to give way for that. So the body itself tells that, now move it, stretch it, contract it, relax it. All these things it is telling. Thereby, you had put the Kachadara into stress, you have put the Lohitacha into stress, you have put the Bahvi or the Urvi into stress, you have put the Ani into stress, you have put the Kurpara into stress, you have put the Indravasti into stress, you have put the Manivanda into stress, you have put the Kurcha into stress, Kurcha Shira, you have put the Kurcha Shira into stress, Kurcha Marma into stress, you have put the Shipra into stress, and then you have put the Talahrit into stress. What you are doing, body knows by itself is that it is. You have sat for a long time, you have put your Kukundara into stress, you have put your Kadiga Dharana into stress, immediately you get up and then release. So anyone need to teach you Marma? No need at all. Once you use the Marma scope, know what Acharyas have told, then you know that your body is doing it. Shall we do an exercise? Like Sarah was doing an exercise, no? You should listen to me. I will give instruction that you have to shut your eyes. I will give an instruction. Commonly what you do for that, you do, don't open the eye. And after that, don't remove your hand, but open your eye and see around. Okay. Now, this way I can teach Marma very easily. Suppose you are having a headache. Suppose you are having a headache. What you will do generally? Don't tell that I will run for Amrutanjan Balm and all. What you will do yourself, close your eyes. You are having a headache. Close your eyes. You are having a headache. What you will do generally? Everyone ready? Somebody goes for dhyana only. They are very highly evolved, so they will be doing dhyana only. Yeah? Somebody will be biting their teeth so that headache will be going. Simply what you will be doing. Okay, now don't remove your hands. Let it be where it was. And then just open your eyes and see around what others are doing. Are you surprised that everyone is having, somebody is having one-sided headache only, so that is why they are doing it. But invariably what you see that your hand has gone there and then it is trying to press it over there. Somebody is having severe headache. She was doing like this. Yeah? Now tell me, just one thing. Did your mother tell that, boy, girl, you are going to grow up. Life is full of headaches. And when headache comes, you have to take your hand and put it on the sides of your forehead and then press it 3 times and then release it. Did your mother tell? Okay, then mother did not tell. Did your father tell? Or you went to the nursery. Now onwards, education is so, you will be asked to pass the exam, so you will get headache. You would like, let the LKG teacher tell you? Did the primary teacher tell you? Teach you? Did the high school teacher teach you? Oh, gone. BAMS you came. First year BAMS teacher, did she tell that, okay, now I am teaching anatomy. This is the first digit of your right limb, upper limb. This is the middle, this one. You have to take it to the lateral part of your forehead where the frontal bone and the parietal bone joins together and press it like that. Did she? Did he? How did you do that? How did we do that? My dear students, realize that we have the potential, inherent, inbuilt intellect within the body to correct it. That, once we know that, we are mimicking it when the symptoms are coming over there. So, one who is having a headache, you go and do that. You know that the Vata has gone for, the body tells that the Vata is doing Adipravarti there. Adipravarti Sango va Siranam Grantiyo Viva Vimarga Gamanam. This is what is happening for the Vata over there. The Srotas has become Dukkha, Dushta. There it is, Adipravarti is happening. So, body tells that go and stop it. Do Sangha. Next time I tell you that if the headache does not go, what usually our rural people will do? What is the next thing they do? Or all over the night you are having headache. You have popped in painkiller also. You have popped, put Zandu balm also. Nothing, it is not working. What you do usually? You take your towel, torth, and then Do the Veshtana. You are not able to stop like this, so you are binding it. Cramp is coming. Patient tells that when cramp comes, I tightly this. Udveshtanam. Pindiga Udveshtanam. Veshtanam is the chikitsa, bringing back into the sun and do the Veshtana, so that it does not go up. Remember that each and every word which we learn in our Shastra, I don't want you to become a Sanskrit scholar or anything, but the technical language it conveys, you have to learn. You have seen the Pujari doing it, no? What he is doing? Where he is doing? First of all, when you are going to do something, when you are going to come to the college, you have this one, no? You do the Sankalpa, no? Oh, I am going to go to college, I have to wear the apron, this one, etc., etc., etc. So, before the Sankalpa, you are making yourself aware of you are not going to the picnic, you are going to the college. So, during the puja, what happens? You do the Tadana at the Uchcheva. Why the word Uchcheva comes there? Whenever you are dull, whenever you want to do something, stimulate that. That's what, when you are thinking, that is what I told you. Here. Ayyo, appa nyabagam varliye. Where do you hit? You hit like that, no? So, Uchcheva. Then, Pranayama, as he told, Pranayama is done. Then what is done? Sankalpa is done. How do you keep your hand doing Sankalpa? Whether left over right or right over left? Usually how? Can you show? Is it not? You tell that for achieving this and this thing, Chaturvida Purushartha Siddhyartham, Dhanadhanya Siddhyartham, Sadvidya Siddhyartham. I am doing the puja. That is Sankalpa. Why it could have been told like this? I am going to do it. Why that Sankalpa has been done like that? I am telling that very, very, very. If you are wearing a bangle, why it is that? If you are wearing a kankana, why it is that? If you are wearing a udhyana, how why it is that? If you are putting a bindi over there, why it is that? If you are putting a, what you call, this thing on the Kodakkadakkan, this one, what is that? It's not just for that. Everything is related to Marma. Okay? So what this is happening when you are keeping what you are doing now, use your Marma scope. Which Marmas are involved when you keep your hand like that? When you keep the hand, which is this Marma here? Which is this Marma here? Talahar over Talahar. You are putting the Talahar and covering it with the other Talahar. Is it not? Thereby what you do, what is your Ida Nadi? What is your Pingla Nadi? What is your Chandra Nadi? What is your Surya Nadi? Whether you are a boy or girl, how you are able to tell? Is there any girlishness in you? No. Everyone has androgens and the other one, hormones. When the androgens or the testosterone is more, you become a male. When the other one is more, you become a female. That's the Sankalpa of Ardhanarishwara. Purusha is not great, Stri is not great. When there is this one and an expression in that way, that is the thing. So, one is the left brain. What is the difference between the left brain and the right brain? What does the left brain do? What does the right brain do?
So right brain is mostly of the intelligence, cognitive functions and all. Left brain is mostly associated with the creativity, artistic things, all those things.
This is cognitive functions. This is the thinking part of this one. This is the executing part. Usually you see that who does carries the world is sustained by whom? The females. They only can do that. Male cannot do that. Because the part of the difference between Purusha and Prakriti, whether Purusha is great or Prakriti is great. No, it is Purusha's, this one itself, exhibitant form is called the Prakriti, according to Sankhya. I know I am boring you, but if you don't understand this, you will not be able to know the nunukku of marma. So you have in your brain you have this thing. In your nadi, Sushumna nadi is the one which is balancing the jnana shakti. Like what is the sattva? Where is the jnana shakti is there? What are the other shaktis? Navaratri is just over, Diwali is just over. What is that? Ichcha shakti, kriya shakti. I have all the desires, sir, but I am not able to do. This is the problem with many of us, no? I want it, sir, but I am not able to do it, sir. Ichcha is there. Kriya I cannot do. So what is puja? In puja what you do? My Ichcha Shakti should be converted to Kriya Shakti by the balancing act of the. So the Ida, Talahrit is coming and the Dakshina or the Pingala Talahrit is coming. The Surya Shakti and Surya Nadi and the Chandra Nadi are being brought together and I take a decision. Because my Sadhaka Pitta is good. Why it is called Sadhaka Pitta? Why Sadhaka Pitta is called Sadhaka Pitta? Sadhakam, Hridgatam Pittam. What is the function of Sadhaka Pitta? Ayyo, sir, sports massage anti the poi kekarengale. Because one Sadhaka Pitta of the athlete is down. You are the massage therapist who have to raise it. Sadhaka Pitta, Sadhaka, what are the functions? Buddhi Meda Abhimanadyehi Abhipredartha Sadhanat Sadhagam. Buddhi is not working properly. Sadhaka Pitta is down. Hypothyroidism, dull. Abhimana, I will do it. I can do it. What has happened with many of your Ayurvedic people? The Sadhaka Pitta has gone down. Me, Ayurveda, Abhimana is not there. Sadhaka Pitta is down. You have to fire. Abhimana Dehi. Abhipredartha Sadhanat. What Abhipraya I have? Sadhanat. I will do it. Abhipredartha Sadhanat. This is the one which is doing, the Sadhaka Pitta is doing. We never remember it because we think that Pranavata is the only thing which is doing it. We always forget the Avalambaka Gaba. Without Avalambaka Gaba, whether the body is there, you want to draw a picture. If the wall is not there, what is the meaning? So these all things have to be taken together. And once you understand that, that's why I tell that even in that Sankalpa, how much Marma it is coming, you know that. And Marma is always hidden. That is why it is not this one. Today that's why again I am telling that 4 o'clock on 17th November, some messages I am trying to give open out thinking. You have to think in such a way that how to get the cryptic clues which are there to open up. Okay. Next. The Marma physician usually deals with acute clinical traumatic situation with methods advised in Sadhyavarana Chikitsa, Bhagna Chikitsa, and Abhigata Jashofa Chikitsa. Shofa you read, Abhigata Jashofa you read about the Chata Ushma, how to control the Chata Ushma, otherwise how it will go for Paka. Bhagna Chikitsa again, Bhagnamna Edi Pagamna. It should not go for Paka. That is there. Vatavyadi, Vadarakta Chikitsas and Rasayana Chikitsa are adopted for chronic traumatic conditions in general. Shirabala 101, 41, 101. Dhanvandram Thailam 101, 41. Again, my dear students, the internees are there. I am asking you. Did you ask your teacher why madam? There are only Shirabala plain, Shirabala 3, Shirabala 7, Shirabala 14, Shirabala 21, Shirabala 41 and Shirabala 101 only. Why they have not prepared 31, 51, 25 or Or they just simply thought that, okay, I will manufacture like that in Bheshaj Kalpana. Is it like that? Did you ever ask that, why, sir, only 14 is done, why not 20? Why 21 is done, why not 39? Did you ask? Now you start asking these things. After learning Marma, you start asking these things. Then you will know that why that question has to be answered. Then you will learn Vada Gadatvam. Vada is in Tvak, what? Vada is in Rakta, what? Vada is in Mamsa, what? Vada in Medas and Asti, Macha, what? Vata is affected to that extent that there is Ojo Vyabhat, then what? So you'll get the answer. You know that? You see whether they are coming. I am just extending. Next, please. The real knowledge of Marma Sharira helps in proper diagnosis, prognosis, and treatment of clinical traumatic conditions of various causes, including sports injuries. I went to Udupi when I was joined the Bhuvaneshwari in 93. 93 I joined Coimbatore Ayurveda College. I joined 93. 96 I was called 95. Prashant sir called me to go to Udupi College for this one. Huh? Okay. Are you ready for the tea? We'll finish it and then. Then they called for the Sharira Teachers Conference. You know that I was like immediately after this one, I never wanted to become a teacher because I told them yesterday that I had failed in Shalyatantra in final year. I have failed in Manasika final year. So I never wanted to become a teacher. But somehow I ranked first in the entrance exam. Got only 5 seats there, 1 Shalya seat for general seat. I got it because I was telling that I was not confident in basic principles. This is some carpentry like job, no? Massage, pulling, pushing. So I will do that, I thought, and then join for that. And this teachers conference, what they had decided, there are 2 days. Because there is time I am telling stories. Stories means real happenings. So when I went to Udupi, morning I went, previous day 2 sessions are over, 2 or 3 sessions over. Sharira Teachers Conference. How many speak Kannada? Only 3, 4, okay. So then I asked, Udupi, anybody is there? Udupi College? Jayakrishna Naik sir was there. So I asked him, please show me your hospital and give me reference of few patients who had a fall or abhigata or anything. So he took me around, called the house surgeons and then showed me 2 or 3. One was knee injury, one was ankle injury, one was shoulder injury, something. So then I took the name and the bed number and all, and that was the only thing. And do you know that we don't have the PPT slides and other time. Only OHP sheets will be there. Lecturing was so difficult. You have to study well and then go only, then only you can lecture. Nowadays it is very easy. The prompter is there, no? So we can. So when I went, morning session was somebody else, and afternoon session I went. Exactly, when I went, I thought that there will be few Sharira teachers. That's all. Okay, happy. When I went, the hall is full, college students, and then all the big people like Anjanaya Murthy sir, and all the big people, Savanur sir, everybody is sitting in front. By that time itself, that I had so much of stage fear also. So I put the OHP sheet, current went off. Imagine my situation at that time. But 1 hour I have to speak. 1.5 hours I have to speak. Then I told that, teacher, this is what something happened. Sharira teachers are here? No, this is what happened. Then I told that in your hospital, bed number 19, he is having an ankle injury. You may be treating for Gulfa Marma injury. Nobody is treating. Nobody is treating in that Marma line at all. But I told that but I will be treating it for Purcha Shiro Marma Abhigada. There is a knee joint injury over there in that bed number 3 or something. You are treating for, you may be treating for Janu Marma Abhigada, but I will treat it for Ani Marma Abhigada. So then by that time I could get all the people onto the, so then I got confidence that I can speak anything. Like, so then went for classification and other things and all. At last I was rather in a difficult situation, whether it's going to be. But suddenly after the end of the thing, what happened, do you know? The Anjaney Prasad sir got up. So then again I went down. Like, Anjaney Prasad sir is getting up and then what he is going to tell? Immediately he got up and told that. Yesterday we had made a resolution that in Karnataka colleges now we will not teach Marma Vibhaga because it is ancient and old and not applicable. We will keep it, we cannot remove from the syllabus, but we will not ask any questions in the Viva or anything. Or as far as possible, avoid in the question paper also. But now this doctor has proved that it is needed for understanding anatomy, physiology, pathology, and treatment also. So now we revoke the decision and we reinstate this, that Marma has to be taught and learned. This was what happened. So even single people can drive in some points. That's what I'm telling. Now here 24, 150, 200 Jijnasus are there. Out of that 20 people, you work with your Marma scope. I know that you can make a difference in that. That's what I'm telling. So that total, that this thing was reverted. So then whatever it is. And now after 20 years, I have Udupi Rajana Sharira students coming for posting for 1 month officially to my place for this one. So that is the conviction. So that's what I'm telling. Sadhaka Pitta you should improve. Along with your Pranata, you should improve your Sadhaka Pitta. Then you will be able to do that. The real knowledge of, okay. Next please, I think we are coming to the end of it. Marma physicians have adopted the different varieties of massages in different clinical situations based on the age, strength and need of the patient. You can see that age, strength and need. And then the rate, rhythm, count, force, structure involved, manipulations like traction, etc. make the difference. How you can make the difference? In the massage, it is not just stroking, but the rate in which you are stroking, the pressure you are giving, all these things make a change. Next, please. These are the varieties of Malayalam Tirumals which are being done. That is called Talodal, Tadaval, Tirumal, Tepu, Ulichil, Tattal, Valikal, Chavital, Kuttal, Amartal, etc. So these many methods are told in different parts of Kerala. It's called Tadava Jigilsa, Tirumal Jigilsa, Ulichil Jigilsa. But each one has a particular technique involved in that. They are the different varieties of massage. The Tattal is beating. Talodal is slow, rhythmic, finger stroking. Tepu is, you know that it is a palmar stroking. So it's a Tattal, you know, Maru Tattal is there. Maru Tattal is there. Next please. The methods of strokes in Marma massage vary according to the site. Though no direct references are found to indicate the direction of strokes in different parts of body, they are longitudinal, transverse, circular or semicircular according to this one. In Ulichal, that is what is done. If you are massaging the shoulder, you are not just doing like that. You are knowing the deltoid, you know the rotator cuff muscles, and you do it according to the contour of the muscle. That is also anulomana. Next please. The rate, rhythm, pressure and other variations are components of massage therapy which determines whether it is stroking, kneading, tappotment or shaking manipulation. That is Tadaval, whether it is Tadaval, Tirumal or whether it is Samvahana or whether it is Abhyanga, whether it is Mardana, whether it is Unmardana, whether it is Udveshtana, whether it is Utsadana, whether it is Gharshana, whether it is Udvartana. This is because of the different methods which we are using. Marma Abhyanga expert has thus designed the massage as per necessity and executed with skill. Next please. So you can see that. So different modalities of massage in Ayurveda: Abhyanga, Mardana, Samvahana, Tadana, Trasana, Padagada, Unmardana, Udvartana, Utsadana, Garshana, Udgarshana, Pidana, Avapidana, Paripidana, Vimlapana, Lebana, Lataveshna, Tenaga, etc. etc. It's not created by me. These are the terms which are available in the textbook showing the different types of massage which we can do. So are you satisfied with just stroking the patient? These many methods are told there. Next, please. Different stroke methods: Nervari, Girvari, Villuvattam, Konu, Pad. These are this one in this one. In Varma Chikitsa, Anukkal, Asaital, Pidittal, Naruttal, Tattal, Tadaval, Undral, Amartal, Padukkal, Karakkal, Pinnal, Endal. 12 different methods are there. Each marma point you can use different methods for different purposes. So these are roughly translated. Again, it will come as Endal means lifting, Amartal means pressing, Asaital means shaking. Okay. Next, please. So, okay, marma massage deals with all traumatic and repeated stress injuries of marmas, acute or chronic musculoskeletal conditions predominantly, involving or not with circulatory or neurological complications which the patient suffers. This is the current definition which has been given by me, because you are relating it with the musculoskeletal conditions, you are relating with the orthopedics, and so this goes well. This is very relevant in sports medicine. Any injury can either involve the circulatory system or the neurological system, or sometimes not, just the muscles only, so or the bones only. So accordingly, you can design your massage. Next. Oh, these are the Vaigalikara marmas which you should be knowing, because sports injury, Vaigalikara marmas and Rujagara marmas are important. So these are the Vaigalikara marmas. Next, please. In that, whichever is coming in the shakas like Hamsa, Hamsapalaga, Kakshadara, etc. are important. Next. Rujagara marmas, 2 Gulfas, 4 Purchashira and 2 Manibandha. Most prone for sports injury. Here only it will come, and patient will come to you after healing also that he is having pain, he is having edema. Very notorious. So at least we are having some methods to do that. Next, please. Patient is living by the skill of the attending physician. Debilitating handicap will occur. As far as sports persons are concerned, please be considerate. You can spoil the entire career if you are wrong. So, Kushalaha Vaidyaha. You have to learn the skill for that. Next. Symptoms are severe pain followed by bad treatment to result in permanent disability. Next, please. Asti marmas. Now, whichever are the Asti marmas and the Sandhi marmas as are told. Next. You have this in the textbooks, and we are winding up now. Symptoms of Asti marma injury. Symptoms of Sandhi marma injury. Textual portion I have not given. Symptoms of Snayu marma injury. General principles of marma management. Snehanam, Jeevaniyam, Brahmanam. Our intention in sports injury management should be this. Next. Stambanam, Ropanam, Vadapittagnam, Balya Rasayanam. Until rehabilitation, where you are strengthening the tissues. From Rasayanam you will have to. Maybe Mamsa Rasa, Ajamamsa Rasayanam. Things like that, which are useful. Okay, next. Some thoughts on rehabilitation. All activities in the body are regulated by the Vada dosha. All the 5 Vadas exhibit alteration deficiency in their activity in Aghata. Whenever there is a injury, all will be affected. The Vada most affected are the Prana and Vyana, but effects are seen in the Udana, Samana and Apana also. Dhadus or tissues are mostly Sira, Snayu, Kandara, Mamsa, Majja, Tuk, etc. These are the injured portions usually. Next, please. Methods are Abhyanga, Pichu, Lepana, Bandhana, Veshtana, Prasana. Okay, next please. Seka, Shirovasti, Nasya, Karnapurna, Pindasveda, Anchana, Avapedana, Sthitisthapana. Okay, these are the different methods which you have to adopt to. Next please. Abhyanga benefits, you know that. Next please. Udvartana benefits, you know. Mardana, Samvahana, Padagada, Parishega. Next. Svedana, different types of Svedanas. Shita Prayogas. Next. Gandusha, all Urta Jatragada Marmas. If they are, for a sports person, anything can happen. No. All these things you can have a scope for doing it. Next. Yukti Vivasriya, Vata Vyadi Chikitsa comes. You have the previous teacher telling that here you become a Sattva Vijaya Chikitsa also. Sattva Vijaya Chikitsa, psychological, including prayer, meditation, etc. Yoga and pranayama, vyayama, Veshtana bandhana or bandaging, Kushadharana, splinting. Various types of splints have come now which can be used. Orthotics. Just refer orthotics. Why you give a cock-up splint, why you are giving a tennis elbow, this one, why you are giving a knee halter or knee brace, etc. etc. This is our traditional Vibandha Bandha. Next. Adangal Prayoga in Tamil Varma Shastra, method of controlled manipulation of the point to counter an injury to another Marma point. When the Sthana Rohida is injured, Sthana Mula is injured, give a pat on the Brahati. This may be also called Maradata as in Kalari Marma Chikitsa. Many newly evolved methods can be seen as based on this. Many methods which are evolved. We talked about many methods. So these things are based on this one. Next, please. Aushadha yogas are Marma Guliga, Nagaradi Leba, Marma Kashaya, Nadi Kashaya, Muruvanna Ashavanna. All Kashayas and Taila yogas mentioned Vadaroga and Vadarakta Chikitsa can be used in sports injury management and sports injury prevention. Next, please. Aims of rehabilitation, prevention of disability as far as possible, maximum reduction of disability, training the person's residual abilities to achieve independent living or independent performance. Next. Ayurveda has a comprehensive holistic approach regarding health, disease and treatment. Rehabilitation of the patient is considered as a part or the continuation of the main course of treatment. Medication, physical therapies and counseling to go together. So as far as a Marma physician is concerned, he is a built-in person. He cannot, as a Marma physician, you cannot stop, okay, my treatment is over, now go to rehabilitation. Rehabilitation is inbuilt within the treatment and continues, and then only it is left out. So a sports injury management by a doctor has to be like that. Next, of course, you can use the expertise in different things. A physiotherapist will have a good exercise therapy protocol. You can adopt it like that. Next, already I told that Abhada Varjanam Nityam, Sustavartasya Anuvartanam, Utpannarthi Vigaranam, Marmanam Paripalanam. Next. Okay, this you can run through techniques of massage. Yeah. You see whether it is playing. This is a sports person. It is done in Kerala Institute of Sports. This one only. That you'll have to click down somewhere. Try clicking. So down in the left hand corner. Or put enter. No. Keep it away. It's a video, whether it is playing. Okay. If it's not playing, okay, go to the next slide. This is Nadia Marma Abhyanga, this is Pidattal, you know that, this one, some pictures. Next. Preparation, taking oil in the hand for massaging. Next. Pedanam Paribedanam, flat kneading, when you counterpose, this one like that. Next. This is a stroking, palmar stroking. Then you have the finger stroking. Next. It's finger stroking. Next. Dating. Next, kuttal or pounding. You pound like this, no? Very hard. Next, Garshana, friction massage, generate heat. Next, pressing stroke. You press and then do the stroke. Next, that's also called kneading massage, kneading stroke. Unmardanam or compression. You compress and release, compress and release. Next, upward stroking or utsadanam or this one. Udvartanam involves circulatory movement. Udvartanam kabaharam, not just like that. According to the muscle, you'll have to. Next, Thirumal or twisting stroke. Spiral massage. Next, picking and kneading, sandamsha, as if do that. Now, if everyone is tired, you can just put your this one on your shoulder or your this one and then just do that. It's very comfortable. Next, Vimlavana with the pulp of the thumb massaging. Next, now see that Indravasti is being pressed or Manna Marma. Marma press or deep pressure. Next, mobilization, Sandhichalana to what you call this one. Next, Marma Thirumal, rotatory massage on the Marma. This is Nanganam Buttu or the Kukandra Marma circulatory massage which is done. These give very good result immediately. Next, Akshara Thirumal or you try to write over is Tamil, try to write, don't move your finger, but try to write Om. You need that how you locally mobilize it. Without with your finger only, you are writing the letter over there means. So that is Akshara Thirumal. Next, Peshi Chalana, when you are doing the Peshi Chalana. Next, Thenar pressure massage with the Thenar pressure. Next, Corpora. Corpora another hitting with the elbow. So that when you want here and all, so he hit with this one, so like that. Rolfing is there. Next, tongue lift massage or Marma pull. Kakatai Kalam is being pulled or the Amsa Marma is being pulled. Next, squeezing massage. You squeeze the calf muscle. This one. Next, hello. Already come? Oh, already. This is the pulling massage. Next is the crushing press. The most comfortable thing. When you do like that, it is very, very good for your foot. Next. Thank you. So, one more slide is there.